Hello, my name is Bailey. I'm the nurse practitioner here at Optimize Integrative Health. And today I'm going to talk about why longevity matters for people in their 20s and 30s. So I just turned 30 this past year, and I have been on my longevity journey for about 3 years now. So longevity can get very misconstrued in that it's really for people who are older or people who are scared of aging, or even people who want to quote biohack and not age at all. But to me, it just really means being as functional as possible for as long as possible. And I'm really going to share a lot of statistics of why longevity should matter to young people and why we need to start working on some of these points now. And this just really comes from a place where I've been a nurse for 8 years now. I worked in the hospital at bedside with very sick people. I've been a nurse practitioner for 3 years now and in the integrative functional space for 4. So lots of experience in the medical field with a wide variety, taking care of people who do not care about their health and then taking care of people who do care about their health. So a lot of my passion and working with patients stems from seeing what happens when you don't take care of yourself. So even now, I think diabetes will be the most terrible thing we deal with in the coming years. There are so many people with pre-diabetes and metabolic dysfunction, which is leading to very terrible outcomes in the hospital. I saw it as a new nurse day in and day out. And I feel like not a lot of importance is being put on metabolic health, which is another component of longevity. So just my background in the medical field and then taking care of people who care about themselves and knowing what's optimal has really driven my personal longevity journey and helping my husband with his longevity journey and really just setting ourselves up for flawless aging, if you will. So again, longevity can involve your level of energy, strength, mental clarity, fertility, your resilience, and all of this really matters and should start. People should start working on this in their 20s and 30s because it will be all the more easier later on in life. So, point number 1, you need to build muscle yesterday. If you do not have an adequate amount of muscle mass, statistically, you will not age well. So again, starting on your longevity journey in your 20s and 30s, I think your priority should be building muscle. This is your reserve for older age, and it's also your insurance for older age. So that's what I tell my patients. It's your insurance for older age. Just all the studies that are out there in terms of health span and lifespan. So for those who don't know, lifespan is how long you live, and then health span is how well you live in regard to how long you live, how functional you are in regard to your age. So the number 2 predictors for your health span and your lifespan are muscle mass and your cardiorespiratory fitness, which I will be talking about for my first 2 points of working on your longevity journey in your younger years. So muscle is not about looking good. If you want to look good, you absolutely can. I work with a lot of patients who want to look good, and we get them there. But it's just more so about being functional. So I wrote down some statistics. So the more muscle you have, typically, the better your blood sugar control is. So the more skeletal muscle you have, technically the more carbs you can eat and the better your blood sugar will be. Additionally, muscle strength is linked to major health outcomes, obviously, because to build muscle, you have to work out. And if you're generally working out, you're generally more healthy. And then muscle loss can contribute to loss of independence when aging. And then strength training also has health benefits on your physical function, your bone health, your blood pressure, and your insulin sensitivity. So here are some statistics. So starting at the age of 30. So again, this is where longevity matters for people in their 20s and 30s. At the age of 30, you start losing muscle mass at 3 to 5% per year. That is why it is so important to build as much muscle as you possibly can, because once you turn 30, it is very difficult. There are supportive measures we utilize here at Optimize to help with muscle building. But really that's something that should be addressed immediately is building muscle. Additionally, people can lose as much as 8% of muscle mass per decade once you get closer to your 40s. And this number can actually double at the age of 75. So again, build muscle yesterday. So that brings us into our cardiorespiratory fitness. So the first is your muscle mass. The next is your VO2 max, also known as cardiorespiratory fitness. For those who don't know what VO2 max is, it's the maximum amount of oxygen your body can exchange between cells when you are under a certain amount of stress. So think running on the treadmill. I had my VO2 max test done a few months ago, and you wear a mask. It wasn't bad, and I did the walking test because I do not like running. I did the walk test and got to a maximum level of energy output, and then it gave me my VO2 max number. I just recently had this done with my husband as well. So your cardiorespiratory fitness is another strong indicator of your overall health. So muscle mass and VO2 max are number 1 and number 2 in terms of longevity. So you do not want to wait to build your endurance, because chances are in your 20s and 30s, you have really good recovery, you have a lot of energy. So building up that cardiovascular endurance can be really good for you in the long run, and then it will be easier to maintain. So like I said, cardiorespiratory fitness is one of the strongest predictors of long-term health. The American Heart Association states that cardiorespiratory fitness is a powerful predictor of cardiovascular disease and mortality risk, and may be as strong or stronger than traditional risk factors like smoking, hypertension, obesity, hyperlipidemia, and type 2 diabetes. So I just talked to a patient today that if your muscle mass is in check and your cardiorespiratory fitness is in check, you can kind of lag on the internal. It's important too, but again, just statistically speaking, the more muscle mass you have, the better your cardiovascular fitness is, the healthier you are, regardless of other factors. So higher fitness is linked to a lower mortality risk. So your chances of dying just sitting there with a high VO2 max are significantly lower. With every 1 MET increase in your VO2 max, 1 MET is 3.5 milliliters per kilogram per minute of your VO2 max, you have a 15% lower risk of cardiovascular events. So good for your heart. It means your heart is very healthy. And some facts about what happens with your VO2 max. So once you turn 25, so again, longevity is important in your 20s and 30s because things start to decline once you turn 30, and even here 25. So your VO2 max, if you do nothing, will decrease 10% per decade starting at the age of 25. And this decline can accelerate even more later on in life and could even get up to 15 to 20% decline at the age of 70. So again, you have to start building up that VO2 max now. So that concludes our VO2 max. So point number 3 is the internal. So metabolic disease, starting to prevent that at a young age. If you are like me, you probably don't go to your primary care doctor very often. And this is where a lot of small preventative lab panels can be drawn. So if you have insurance, use it. Go see your primary care doctor and get a panel on what your metabolic health looks like. Most panels involve, in terms of metabolic health, maybe a fasted glucose, maybe a hemoglobin A1C, and a cholesterol panel. This is great. I would also advocate for getting a fasted insulin because this gives us more of an insight into how well your metabolic health is functioning, as well as something called a CRP, C-reactive protein, which can tell us the level of inflammation in your body. So, decline of metabolic disease doesn't happen overnight. It's a very slow process. And here are some statistics. So earlier in the podcast, I mentioned that diabetes will end up costing our money, or will end up costing our country a lot of money, because diabetes can cause so many other health issues. So prediabetes is very common in US adults. The CDC reports that 115 million Americans have prediabetes, and 8 out of 10 of those people don't even know that they have prediabetes. It's not something you feel. I mean, maybe somebody might have terrible energy levels or crashes in the afternoon. That could be prediabetes, but it's not something you feel. And diabetes is so common in the US. From August 2021 to August 2023, almost 16% of Americans have a diagnosis of diabetes. This is insane and makes me sick to my stomach. And metabolic disease isn't always circling back to blood sugar. It can go with how high your insulin levels are, and this can lead to heart disease and stroke if this is not addressed immediately, which heart disease and stroke are one of the highest contributors to deaths in America. And is it because these people had diabetes? I would imagine so. And this starts younger than you think. In 2023, 8.4 million US adolescents between the age of 12 to 17 had pre-diabetes. I have no words on these statistics. So again, prevention starts young. If you're in your 20s and 30s, go to your doctor or come to a functional health place like us. We run these panels all the time, and ask for a hemoglobin A1C, because this is a diagnostic marker for diabetes. The threshold is below a 5.7. I see that it's even too high. I tell my patients I want you to be between a 5 and a 5.2, really closer to a 5. And this is a 3-month average of how stable your blood sugars have been. And 5.5 is just too high. Prediabetes is considered a 5.7 to 6.4. And once you're a 6.5, you're considered a diabetic. I think in the hospital, the highest hemoglobin A1C I saw was a 25. If you've listened this far in the podcast, let me know, any medical professionals here, what the highest A1C you've ever seen, because I know that's not a number people forget. So again, check for a hemoglobin A1C, but that's not where it stops. You want to ask for a fasting insulin. And this again just shows us how well your body is handling the glucose. So I've seen some people who have had normal hemoglobin A1Cs, and that's because the body does really well at maintaining homeostasis, so maintaining normal functioning for as long as possible. But when that insulin starts to creep up, the hemoglobin A1C can start to creep up. So being really proactive about getting that fasted insulin. And also with the inflammatory markers of CRP, C-reactive protein, that's produced by the liver. My goal for my patients is a 0.8 or less. I think the highest CRP I've seen here in practice is a 30. So again, any medical practitioners, let me know the highest number that you've seen as a CRP. So again, it's diabetes. If we don't get this under control and provide more education on this and stress the importance of a diagnosis of diabetes, I'm very curious to see how the increase of these diabetes diagnoses will affect healthcare in the coming years. And that is definitely something you want to prevent. And I try not to be dramatic. I try to be as low stress with my patients, because being healthy shouldn't be stressful. it should just be like icing on the cake to your life and something you enjoy. But once somebody is diabetic, they are basically a ticking time bomb for a heart attack or stroke. And I don't think doctors or some people don't care about their health, but we need to stress the importance of that and get that under control. So metabolic health does not just affect your risk of diabetes or heart disease, it also affects your brain too. So we want to prevent dementia and Alzheimer's, and this does go hand in hand with your metabolic health. If your metabolic health is not optimal, it could increase your risk of dementia, but there are other things you can do for decreasing your risk of dementia, and we will get into that. So brain health is so important, and a lot of it just stems from being a constant learner. Learn something, contribute to your community. This helps your brain so much as well, in addition to keeping your metabolic health optimal. So in terms of statistics, dementia risk can be modifiable. So there are actually 14 modifiable risk factors across the lifespan, and just a few of those are not maintaining a level of education. So read those books: hearing loss, high blood pressure, smoking, obesity, depression, physical inactivity, diabetes, excess alcohol, traumatic brain injury, air pollution, social isolation, high LDL cholesterol, and vision loss. So there is a trend here that if you neglect your senses, your brain health could deteriorate as well. So getting outside, reading a book, maintaining friendships, that's all so good for your brain and preventing dementia. Physical inactivity was mentioned here as well. So that circles back to exercising and keeping up on your cardiorespiratory fitness. Dementia is a major global health issue, and 57 million people worldwide had been living with dementia in 2021. This is a lot. And 7.2 million Americans aged 65 and older are living with Alzheimer's dementia in 2025. And that number could increase to 13.8 million by 2060. So again, you have to protect your brain, and everything I've mentioned up until this point will also decrease your chances of dementia. But you will be worse off if you do not continue as a functioning member of society in older age. Now we're going to go to the other end of the spectrum. So we talked about dementia, which happens in older age. Then we're going to go to something that happens more so in younger age, which does matter for people in their 20s, 30s like me: fertility. So fertility is definitely a health-related issue if someone is experiencing infertility in their journey of starting a family. And yes, metabolic health and reproductive health are very closely related. If you do not have healthy metabolic health, this can affect the menstrual cycles. This can affect if one ovulates. It could affect if an egg gets fertilized. And it's not just for the woman, it's also for the man. So there are studies coming out where sperm quality can affect the chances of pregnancy, but also affect the health of the pregnancy. So some statistics here: about 1 in 6 people will experience infertility in their lifetime. That's almost 20% of our population, and that number is actually rising due to our health crisis in this country. Obesity can negatively affect menstrual cycle, ovulation, and fertility, and also pregnancy outcomes. So your weight, how much fat mass you have, can really affect the health of the baby and the health of the pregnancy. And your preconception health does matter. The state of your metabolic health, your weight, chronic disease. So in addition to that, PCOS is one of the leading causes of female infertility. And a lot of PCOS, the root cause is insulin resistance, which should be fixed. So again, it matters for fertility. If you are in your 20s and 30s wanting to start your longevity journey and want to have children later on, It is so important to be checking your metabolic health and having that muscle reserve put on and not having a large amount of fat mass, because it will really help with conception and the health of your baby later on. And same thing goes for men. Your sperm quality absolutely does matter, and what you were doing 3 months ago can affect the sperm quality in terms of alcohol consumption, marijuana use, sleep quality, etc. So again, it's not only physical health, and longevity habits can also support how we feel mentally and emotionally. So longevity in terms matters for mental health. We are in a mental health crisis in America, if nobody noticed. So the CDC's 2024 National Health Interview Survey released data that showed 12.1% of US adults had regular feelings of worry, nervousness, or anxiety, and 4.8% had regular feelings of depression. That's a lot. Longevity, I feel, if you work towards your health and your health span and lifespan, it will help your mental health indirectly. I do think a lot of this stems from low physical activity. We are meant to move. We're not meant to sit around all day. I'm guilty of it. I work at a computer and a desk, but really just making it a priority to get outside and walk. And I joke with my husband, like, I just need to touch grass. Just go touch grass. So again, physical activity is consistently linked to lower depression risk. Obviously, if you feel depressed, start moving, but don't be afraid to ask for help if you need it. Additionally, movement helps not just with prevention, but also with symptoms. A 2024 JAMA article summarizing a large meta-analysis of 218 randomized controlled trials involving more than 14,000 people reported that exercise, especially walking, jogging, yoga, and strength training, can help reduce depression symptoms. So again, working on your longevity journey, the top two are muscle mass and VO2 max. So even just doing this can help your mental health, and that matters for longevity later on down the road, because you don't want to be depressed working on your health. It's not fun. And this matters for younger people too. Even in a pediatric population, meta-analysis found that physical activity produced greater reductions in depressive symptoms in children and adolescents. So again, mental health is definitely a part of longevity. If you are anxious, like I said, it's not going to be fun to work on your health, but even exercise can help with anxiety and depression. Okay, here is my last point, and it's something I'm very passionate about. I have a 2-year-old son, and it is, our legacy is so important. I feel like my generation is more children focused than prior generations, and that is because we are noticing that how we're raised affects the coming generations, obviously. And our children don't just inherit our genes, they inherit our lifestyle. So why is most of America obese? It's because the generation ahead of us didn't have a good foundation of nutrition education and exercise education. So for those of you who have children and are passionate about your health and longevity, we are setting up the next generation of healthy kids who will soon be adults in society. And I feel like that is a really important job that we have as parents. So again, and you have to look at the statistics here that we have an obesity epidemic of young children in the US. So the CDC reported that 49% of children aged 2 to 5 had obesity, 22% of children ages 6 to 11 had obesity, and 23% of adolescents 12 to 19 had obesity. And worldwide, the WHO reports that 81% of adolescents ages 11 to 17 do not get enough physical activity. So we we have to prevent this. We need to display all these healthy habits I talked about. So muscle mass, exercise, cardiorespiratory fitness, working on your metabolic health, eating in a way that supports your metabolic health, your mental health, dementia prevention, being a productive member of society, a contributing member to society. Working on your fertility is so important for our kids. They're always watching, they're always listening. We do not give them enough credit with how smart they are. And it's really my motivation to display these healthy habits to my son so that he can be healthy and have a long lifespan and health span as well. So to conclude, longevity is not a fear-based method. I feel like a lot of doctors, nurse practitioners in this space operate from fear, and it doesn't have to be that way. I tell my patients, look, your labs are not optimal. Do not assign emotion to it. It is simply data, and we can improve it. So just looking at all of these as data points and knowing that you can improve it, because again, this podcast is for people in their 20s and 30s and how they can start their longevity journey. If you have a lab panel done and they're not optimal, the great news is you're young and these things could be fixed very quickly if you get on top of them. So this does not have to come from a place of fear, but a place of awareness, knowing that if you do not start working on this stuff now, it is going to be very difficult to get on top of it. So start building muscle now, start working on your cardiorespiratory fitness, start learning more every day, get a lab panel done to check your metabolic health, start working on your fertility if you want to have children. Know for sure that you can have children. Start tracking your menstrual cycle, start tracking your ovulation. And then finally, display these habits for your children, and it will be the biggest blessing to your life. If you are located in Florida, we do accept patients, and if you are in your 20s and 30s and want to start on your longevity journey with some guidance, you can absolutely book a consultation with me or a discovery call with me. And I am just happy I was able to do this podcast and just start creating awareness around the longevity journey for younger people.